Hello friends, welcome back to my YouTube channel. And today I am going to start one of the important topic from pharmaceutics first, that is unit 4 suppositories. In this video we are going to cover definition, types, advantages and disadvantages of suppositories. So without any further delay, let's begin with our today's session. So first of all, what do we mean by suppositories? So suppositories are solid or stiffened dosage form which mean to insert or introduce into body cavities like rectum, vagina and urethra. They are formulated as bougies for nose and urethra, pessaries for vagina and suppositories for rectum. They are formulated as tablet and capsule and are referred to vaginal tablet and capsule. Suppositories are introduced into rectum, vagina, urethra, where they melt and get softened and dissolved to produce local or systemic effects. So this is the basic definition and introduction behind suppositories. Now coming to the different sizes and shapes for suppositories. So there are various sizes of suppositories like 0, 1, 2 and 3, 4 and AB. For children, we can use 0 size suppositories. For rectal use, we can use 1, 2 and 3 type of suppositories. And for nasal and urethral bougies, we can use A and B size suppositories. So this is all about the sizes and shapes of suppositories. Now coming to the advantages. First, they are more convenient dosage form as they are introduced at the site of action to produce systemic and local effects. Example of drugs are emollients, astringents, antibacterial agents, hormones, steroid, and local anesthetic. Suppositories effective in patients who are unconscious, those who are not able to take oral drugs with poor absorption in GIT, people having GI disturbances and in condition like nausea and vomiting. They are also effective dosage form in paralytic ileus. As the drug is directly introduced at the site of action, they avoid hepatic first pass metabolism and hence the onset of action in suppositories is quick as compared to oral dosage form. Suppositories can be used to deliver high doses of drug. However, the doses of drug is different in cases of suppositories and pessaries. Drugs like sedative can be formulated into rectal suppositories as high doses as compared to oral dosage form without producing any toxicity and overdose issue. So this is all about the advantages of suppositories. Now there are some disadvantages of suppositories like oral dosage form are more convenient than suppositories. Hence suppositories are not much favored by patient. Patient avoid suppositories as they are directly inserted into body cavities which may produce discomfort. Manufacturing of suppositories is very costly than tablets. The bases used in suppositories may affect the stability preparation. For example, cocoa butter having low melting point are difficult to store and melt at room temperature. So this is all about the disadvantages of suppositories. Now what are the different types of suppositories? So there are total 5 types of suppositories. First, rectal suppositories, second, vaginal suppositories, third, urethral suppositories, fourth, nasal bougies and fifth is ear cones. Let's discuss one by one. First, rectal suppositories. Rectal suppositories are cylindrical or conical and tapered in shape or pointed at one end. They generally weigh approximately about 2 gram and are about 1 to 1.5 inches long. Infant suppositories weigh approximately one half that of adult rectal suppositories. The modern rectal suppositories is a conical shaped which is about 2 to 3 centimeter length. Suppositories for adult weigh 2 grams each and children suppositories weigh 1 gram each. Then second, vaginal suppositories. Vaginal suppositories are also called as pessaries. Vaginal suppositories are formulated as vaginal tablets. These tablets are available in various shapes. Example, ovoid or globular and weigh approximately about 3 to 5 gram each. Then third, urethral suppositories. It is also called as bougies. These are usually about 5 mm in diameter and 50 mm in length for females and 125 mm in length for males, with weight 2 gram for female and 4 gram for male. Suppositories are indicated for administering drug to infants and small children, severely debilitated patient, those who cannot take medication orally, and those for whom the parenteral route is unsuitable. Now coming to nasal bougies. These are prepared with cocoa butter or glycerogelatin base. They are thin, cylindrical and rarely reused suppositories. They weigh about 1 gram and are 9 centimeter long. Now coming to the last type, that is ear cones. It is also called as orinaria and are rarely used suppositories. These are prepared with cocoa butter base and are 8 to 10 centimeter long. They are thin, cylindrical with weight about 1 gram. So this is all about the types of suppositories.